All right, I want to correct you in this question because you made the wrong selection, right? Let me explain. Now, but before I just jump into explanation, remember last class, right? Um I said when you are answering infection control question, pay attention to this because this is what the NCLEX test. Right. First of all, you need to know airborne droplet contact, top priority for infection control. You need to know the infection related to the three. What infection belong to airborne droplet and contact. That is when you now start knowing the precaution. Now the problem is that a lot of students might know the infection related and also know the precaution, but they don't know how NCLEX tests the question. That is what throw a lot of students off. So you can have the solution, right, to the problem, but you don't still know how to fix the problem if you don't understand the problem. You understand? So that's what I want us to fix right now. Now let me now tell you. Room. I said this previously. Room, PPE. This is what NCLEX says. Hand hygiene. So you need to pay attention to every answer keys to find out what the NCLEX is testing in each. Now, hand hygiene or your question in general. Hand hygiene. Um, this is quoting two or more clients together, right? What else do we have? We have transport, okay. And then lastly, we have private room. It's just six in number. Private room. 1, 2, 3, 4, 5, 6. Now, this particular question obviously is testing us on private room. The formula for private room is airborne, immunocompromised, droplet, and contact. That is the formula. Anytime you see private room type question, when the NCLEX is telling you only available private room, right? Who are you going to assign to the only available private room? This is the formula. Now, this is what you are going to do. You are going to scan through the list of patients. You are going to find out who have airborne. If you see airborne, that's your answer. But if you do not see airborne, you are going to next scan for immunocompromised. Right. When you scan, if you did not see immunocompromised, then you look for droplet. You do same thing. If you see droplet, you select your answer. If you don't see, the last thing is contact. Right. Never select standard precaution infection. It's not related. The standard transmission base is airborne droplet contact. This is what NCLEX prioritize. Standard precaution infection are not as strong as all this kind of infection. So NCLEX is big on the top most priority infection, which are the most contagious infection, which are airborne droplet contact. So yes, the truth is NCLEX is going to give you infection related to standard precaution, but you should be able to differentiate the infection related to standard precaution and as well to airborne droplet contact. Now, when I look at this question, I'm looking for airborne first. Right. When I check right here, I can see varicella related to airborne. But guess what? The NCLEX is saying a positive titer. Here too, the NCLEX is saying a positive titer. The meaning of a positive titer is that this patient is immune to this infection. So this patient don't have this infection. They don't have the infection. They just have immunity to that infection. So you need to understand what titer means. Titer means the patient have what? Immunity to that infection. They have positive immune to that particular infection. So a patient that is immune to a particular infection, right, or they have gotten vaccine towards that infection, does that mean they have the infection? Obviously no. So 2 and 4 is out from the picture. So you are left with 1 and 3. Now, next thing I'm going to look for is what? Immunocompromised, because there's no airborne again. This is not airborne, this is not airborne. Right. This is the only thing that look like airborne, but it's not an infection because positive titer means that the patient have what? Immunity to what? That particular infection. So now I'm done with airborne. So next is immunocompromised. Who are my immunocompromised patient? Patient on chemotherapy, patient that had what? Any form of transplant, right? Patient that have any form of transplant. Your HIV patient is what? Immunocompromised, right? Patient on what? Neutropenic precaution, they are immunocompromised. So these are your top 4 immunocompromised patients: transplant, chemotherapy, neutropenic precaution, HIV. Now, am I seeing anything like that here? Obviously no. So there's no immune. I'm going to move straight to droplet. Right. So because I've eliminated this before, so I'm left with this and this. So this is the 2 I'm looking for immune. There's this not immune problem, this is not immune problem. Now droplet. This is not droplet, but this is droplet. So right now my answer is what? 3. I don't need to look for contact again because I'm following the what? the arrangement. So droplet, immediately I've seen droplet, that is my answer. Right. What is hepatitis C? Hepatitis C is a standard precaution. Hepatitis C is not even related to airborne immune droplet contact, or hepatitis C is not related to airborne droplet contact. We have top priority on the NCLEX exam, which is hepatitis A, B, and C. B and C is standard precaution. Remember that. B and C is standard precaution. Hepatitis A is contact. Right. Hepatitis A is contact. B and C is standard. There are other things that belong to standard. You need to know standard infection different from what? Airborne droplet contact. And you need to understand the role of what? A positive titer. So that you don't think it means the patient have positive airborne infection. Okay? So the correct answer to this question is 3. Right.